Okay, so there's a little bit more I want to talk about the incisions and the scars. So first of all, there are some facelift techniques that take the incision directly into the hairline where we go just above the ear into the hairline. I don't do that. A couple of reasons for that. One is that often when that is done, because of the amount of skin that we frequently have to remove in the cheek, if that's taken out in the hair-bearing scalp, you're repositioning the sideburn, and sometimes it can make it look like there's very, very little sideburn, and that looks very unusual. At least that's my opinion. So I don't do that. I always do the incision in front of the hairline, and again, while it is a scar, it's always there. It's very difficult to see in the long run, and frankly, I think that's a lot less distracting than a sideburn that has been minimized or repositioned in a way that no longer looks natural. So that's one additional thing I want to talk about: incisions and then the scars associated with them. The other thing is, what can we do through the incision here? Through the incision from here to here, we're really lifting and addressing the structures above the jawline. In order to make any difference, any benefit in the neck, that's where we require the incisions behind the ear, extending across what we call the mastoid region and into the hair. That really allows wonderful access to the neck. It allows the removal of all of that excess in the neck that patients want to have removed. And so even though that's additional scars, there's certainly a lot of value that is gained from that. A lot of people ask, well, what about a short scar facelift? And that is a reasonable alternative. The challenges with that is that you often cannot remove as much skin underneath the neck as you would like. And you can't remove the fat, at least in the way I like to, under direct vision, underneath the neck, as opposed to liposuction when I'm doing a true open neck lift. I can't do that as well if it's a short scar facelift. So, a short scar facelift definitely, it sounds appealing, and there's certainly, people who do it very well. But what I would say and what I would challenge people to understand is that the incisions that are often not used are the ones that are actually very well hidden in the hair, the hairline, and behind the ear. So to me, I like that full access to really be able to achieve the most natural appearance and the best deeper structure lift that is possible, so that you don't need to put a lot of tension on the skin. One other incision that's important to mention is what we call a submental incision, about 1.5 inches, sometimes only 1 inch, that's made behind the chin. It doesn't extend up onto the jawline at all. And the purpose of that is to be able to gain access to the structures of the neck, to remove some of the excess fat there. Sometimes we even have to remove a little bit of the submandibular gland, which is the saliva gland, and then tightening the muscles centrally. And then again, usually we're tightening the muscles laterally or towards the outside of the neck through the incisions that we make behind the ear and then into the hairline. And so that again is a pretty small incision. It's under the shadow of the chin. It doesn't really extend up to the jawline, and that heals very well and is very difficult to see in the long run.